Hello there, I'm Dr. Jeffrey Niesgoed. I'm the president of the American College of Hyperbaric Medicine, and I serve on the executive board for the American Professional Wound Care Association. These two organizations are collaborating societies with a meeting that provides an excellent educational opportunity, and that is the new Cardiovascular Horizons. This year, it's the 16th annual meeting, and we would like to talk to you a little bit about this special educational opportunity. Joining me is Dr. Frank Tursi. Dr. Tursi will be the program chair for the wound care track at this meeting. Hello, Dr. Tursi. How are you?
How are you, Dr. Niesgoed?
I am great. Listen, for those that don't know you well, why don't you just give us a brief introduction of who you are and why you're involved in this meeting?
Sure. I am a podiatrist. I graduated from the Pennsylvania College of Podiatric Medicine, which is now known as Temple University School of Podiatric Medicine, in 1985. In my opinion, again, because I attended there, it was the best school that you could attend. Upon completion, I did my residency down in Atlanta, Georgia, and trained with some very notable podiatrists, one in particular, the father of podiatry, E. Dalton McGlamory. I had a tremendous opportunity to spend a great deal of time with Dr. McGlamory, as well as about 65 other podiatrists that admitted to our hospital. And we did somewhere in the neighborhood of 10 to 15 surgical cases per day.
Great.
With that kind of volume, I had the distinct opportunity and pleasure of performing all different types of reconstructive foot and ankle surgeries, including tibial derotational osteotomies, clubfoot repairs, posterior tibial tendon transfers, and very complicated foot and ankle surgeries. I opened private practice in 1990, came back to New Jersey where I had been born and raised, and now have 6 offices with 6 podiatrists working along with me in a very large network. We perform anything from geriatric care to the most advanced reconstructive surgical procedures itself.
Very, very impressive resume. Obviously, with a practice like that, I'm sure it includes a significant amount of wound care. I would say that you're probably a wound care expert as well.
Well, we have a very strong presence at Our Lady of Lourdes and actually helped develop their wound care and hyperbaric medicine center over 10 years ago. We staff it, we're co-directors with general surgery there, and we staff it 4 days out of the 5 days a week, both monitoring HBO as well as conducting and overseeing all the wound care there of lower extremity.
Why don't you share with us your perspective on why someone looking for educational opportunities and meetings would pick New Cardiovascular Horizons?
Well, there is a natural symbiosis between the wound care specialists, podiatry, and vascular medicine. As you know, New Cardiovascular Horizons really draws in the most prominent interventionalists in both cardiology, in radiology, and also in vascular surgery. So we have a tremendous deal. In fact, I heard a recent quote that of the attendees at NCVH, about 60% of all interventions done in the world are performed by attendees of this conference itself. We are here to save limbs, and ultimately, by saving limbs, we're saving lives. Diagnosing something like peripheral arterial disease is enormously beneficial to the patient when it's caught early, because we can get them into the vascular network or pipeline early, and interventions can be performed to reperfuse the actual lower extremity.
So as the program chair for the wound care track, why don't you provide us what's going to be new this year? What's exciting? What do you have planned for us?
Well, actually, I put together a 2-day lecture series that will be divided into 4 separate parts. I've really selected nationally recognized practitioners around the country without paying attention specifically to whether they were frequently doing lectures and such. I wanted really the best and the brightest in the practicing fields, and I selected people really from East Coast to West Coast. All the schools in podiatry are represented presently, UCLA School of Medicine, Harvard, and Mass General. We kind of have selected people strategically to bring their expertise in here. The 4 different divisions are going to be divided into essentially a vascular day where it'd be the vascular considerations of wound care. We also will have a diabetic and neuropathic consideration section, a dedicated wound care session, and then a business of wound care session as well.
Fabulous, fabulous. You know, I love that concept. You know, there's many meetings that are available to us to pick from. And if you look at the cadre of faculty, year after year, it's the same old cadre. I love your idea of bringing in some new talent, if you will, some new expertise, new faculty. You know, these guys are engaged clinically. They're cutting-edge medicine. It sounds like a fabulous opportunity to learn really the state of the art, if you will, as far as wound care is concerned.
Jeff, I'm very excited. I really am honored to have this position, and I think that going forward from this point on, we're going to have an incredible reception. We're going to have an incredible response and number of attendees nationally.
Frank, any last closing comments?
Again, I think that you will be enormously gratified and excited and will benefit tremendously from attending the new Cardiovascular Horizons. It'll be something you'll want to put on your calendar every year.
Fabulous. We'll see you there.
Thank you very much.